All right, guys, gonna make this one short and sweet, hopefully. We're gonna talk about knee pain and own in on a certain cause of knee pain. So if you're doing any type of extension or flexion with your knee and you're feeling some clicking, pain as you're doing those actions, one reason is because the patella is getting pulled off its track, okay? So the patella is essentially a train running on train tracks being your femoral condyles. And if there's anything pulling unevenly during that process of flexion extension, it's going to cause pain eventually. So one source of that pain could be from IT band contracture. The IT band is essentially an extension of the tensor fasciae lata at the hip, TFL, IT band, and the IT band splits or forks into two insertions, one at the Gerdy's tubercle and the second on what's relevant here, and that's the LPFL. The LPFL is the lateral patellofemoral ligament, which inserts into the patella laterally, okay? So if there's any type of contracture between your TFL or IT band, well, what's that gonna do? That's gonna cause some type of issue with our train on the track, okay? Now, what can we do? Well, we can do some special tests in order to identify if that's truly the issue. One would be the Noble compression test. You'd be laying supine with your knee at 0 degrees, and you'd be palpating right between the IT band and the patellar insertion. And we're going to basically flex and extend our knee from 30 degrees, ideally with a partner, but what you should feel under your fingers is a grinding feeling. That would be a sign or a positive sign that that's potentially the issue. The second test we can do is the Ober's test. Now the Ober's test, you would be laying on your side, you would have somebody pull or extend your hip and slowly lower your leg down, putting it into adduction. And if that leg comes bouncing back up, well, that means this IT band's very tight, which is another positive test. So what can we do to treat this? Well, unfortunately, I haven't gotten too far into the treatment part of my program, but I can tell you what would make sense. And to me, what would make sense is foam rolling or helping break up any adhesions and tightness, contracture in our IT band or TFL. So you would basically take this, lay on the ground, and just put as much pressure without it being too comfortable around your IT band, TFL, and as distally to your knee, well, as close to your knee without causing any pain at the joint. Hopefully that helps.